Hello, I am Dr. Mridula, consultant obstetrician and gynecologist, laparoscopic surgeon and infertility specialist at Aster Hospitals, JP Nagar, Bangalore. Today let us speak about something very important which is an integral part of a woman's life, menopause. So what is menopause? When we define menopause, we define it as that point of time in a woman's life when she stops menstruating forever. It is a retrospective diagnosis. When do obstetricians say that you have attained your menopause? When a woman has not had her cycles for last 12 consecutive months, she is deemed to have attained her menopause. Usually this happens between the age of 40 to 55 years, but it is a genetically predisposed thing. That is, if your mother, your grandmother has had menopause at a certain age, you are more likely to have your menopause at that age. So usually it is a natural event of in the cycle of a woman's life, but it can also be medically induced. That is, if your ovaries has been removed for any medical indications, or as the ovarian function has declined because of chemo or radiation, then yes, you can have menopause which is medically induced. Any woman who gets a menopause before the age of 40 years, that is not normal, and it is called as premature ovarian failure, or premature menopause we can say. So why do menopause happen? It's a reflection of the declining function of the ovary. Ovary is that endocrine organ which produces the female reproductive hormones estrogen and progesterone. So we women are born with a fixed number of follicles, and from the start of puberty, these follicles, every cycle the follicles are getting depleted, and when we reach menopause, they are completely depleted of all the follicles, and so there is no reproductive hormones, no or very less. That is why our menopause stops. See, it is not an overnight event, like it doesn't stop one day. It's not a switch which goes on and off. It is a range of events happening. Usually it starts 8 to 10 years before the actual menopause sets in, and this period is called the perimenopause. Your cycles which have been regular starts becoming irregular, or like once in 2 months, 3 months, sometimes like frequent bleeding, and finally it wanes and it stops. And the symptoms of menopause happens during the perimenopause as well as menopause. It's not like only after menopause you start experiencing the symptoms. The main symptoms of menopause are, and all these are again a reflection of declining estrogen in our body. So what are the effects? The effects on skin are that the skin, estrogen is the hormone which keeps us young, radiant and glowing. So when the estrogen is waning off from our body, the skin becomes dry. It keeps more irritable, more itching. Whether it be the genital skin or you can experience dryness of the vagina. Pelvic floor muscles become weakened, and this again causes urinary symptoms because we tend to lose tone of the sphincters. So recurrent UTIs, urinary incontinence, that is inability to hold urine, the urinary urgencies, all these symptoms can happen. And two very peculiar symptoms associated with menopause is, one is hot flushes and the second is night sweats. So hot flushes are as a feeling of intense warmth and redness which spread over the areas of head, neck and your chest area, which usually happens without any premonition. All on a sudden it can last from few seconds to many minutes, and usually it is followed by profuse sweating. When it happens in the night and the woman wakes up and is drenched in sweat, it is called night sweats. These are very peculiar things associated with menopause. And another thing is like it is associated with mood swings, and we can have irritability. See, many studies have proven that it is not as severe as the general talk is. Like once the menopausal female people have categorized as and kept, it is definitely not so. It is a amalgamation of things, like you are aging as well. So most depression and the severe psychological effects is usually something underlying which gets precipitated, but of course mood swings and irritability is common in the perimenopausal and menopausal age. Now that we have understood the signs and symptoms of menopause, if any one of you is suffering from any of these things or want to understand it better, please come to us at Aster Hospitals, JP Nagar, Bangalore. We are always there to help you out.